Hello, everyone. Happy Monday. Monday, March 15th, it looks like. It's been a crazy one again this week. So, hi, I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. I'm here to provide a brief update on the impact of the COVID-19 pandemic on Mobile County. Last week we found ourselves at the end of the first year of our COVID-19 response, with Alabama having just over 500,000 cases and 10,000 deaths. And, we are starting to see some light at the end of the tunnel with the number of cases reported in Mobile residents, the number of hospitalizations reported, the number of deaths reported, the percent positive lab results, all trending downward to some really unbelievable lows, which is great. And we have the hope that comes with a vaccine, three very effective and safe vaccines. So we're hoping that the next 52 weeks of our COVID response will look much different. But for today, we're reporting a cumulative number of cases as 37,037. 219 cases were reported to us yesterday, but the overwhelming majority of those were due to backlogs of a couple of labs cleaning up and pushing results that had not previously been reported. So these were specimens that were collected, in 2020, some of them as far back as April, that again had just gotten reported to us yesterday. So in that 219, about 200 of them were, the specimens were collected well into 2020. So that spike does not look great on our curve, but again, it's just we know that spikes can be due to laboratory reporting delays. Yesterday, 2 additional deaths were reported, bringing the number to 757, and 7 additional people were hospitalized yesterday, bringing the cumulative number hospitalized to 4,752. And in the hospital yesterday and over the weekend, less than 50 people were hospitalized with COVID on a daily basis. Yesterday, the number was 45. Again, today on Mondays, we publish our expanded weekly report that gives some more information. I mean, it's just remarkable to see that the number of cases that were reported to us last week was 301. And let's see, it looks like the last time it was that low was back in October. So we are still not seeing the very low numbers, not the lowest numbers, but we're getting there, which is very exciting. Okay, so if you look at figure 3, which is the number of cases reported to us monthly, sorry, little direction going on there. It seems like Dr. Eichhold is going to join us to say a few things. So in the month of February, the number of cases reported to us was 29,026. That's like that's 30% of the cases that were reported during January. So again, all indicators going down. Cumulative number the number of hospitalized daily going down. Our deaths finally are going down, and the percent positive laboratory results is down to 4%. So this is about as low as we have seen since the very beginning. So incredibly low number of positive laboratory results divided by the total number of results performed. So we still see over 5,000 tests performed weekly, and we need to keep that number up. So if you need or want COVID testing for any reason, let's say you're planning to travel around Easter, or you're going on spring break, or you just, are wanting to go visit some family members, please know before you go and call us to get an appointment to get tested, 251-690-8889. And testing is at no out-of-pocket cost to the individuals. So please remember that keeping the number of tests performed each week needs to stay, above the 2,000 mark for a county of our size. So certainly, please, if you have been exposed, if you feel sick, if you are just want to know your status before you travel, please give us a call and let us get you tested so that you can have that information, because testing, is also a prevention tool so that people who have asymptomatic infection can know that and stay at home and not potentially spread COVID to others. So we want to make sure that we keep our testing numbers high, in addition to continuing to message about getting vaccinated for COVID as soon as you get the opportunity. All right, there are a couple of questions this week only. One, something that Dr. Eichel mentioned last week about saying about 20% of people were vaccinated, and someone from the media wanted to know where that information came from. So there is a public report that the Alabama Department of Public Health has on their hub, and I downloaded this for March 11th, so it looks like it was probably good through last Thursday or so. And that day, the report shows that 440,000, almost 441,000 people have completed their vaccine series. So you can sort of do some math and get at that approximation. One of the things that the state health department does when it's calculating the percent of the population that have been adequately vaccinated is that they only report on the percent positive in people age 16 and over. So when they determine the denominator, it's people who reside in Alabama that are 16 and older. There are some graphics also that help you sort of see what percent of the population has been vaccinated in different age groups by sex. So for example, in the age group, let's see, 65 to 69, for example, about 37% of people who are that age have been vaccinated. But if you look at people 75 and older, about 60% of people in Alabama who are 75 and older have been vaccinated. So again, looking at just that 16 and older category, it's about just under 20% for the state, and that holds true for Mobile County. All right. Also asking about rates, vaccination coverage by county. So this is coming soon on the alabamapublichealth.gov website. We have seen some drafts of the county level data. So again, I expect that state will be making that publicly available very soon. And we are encouraged that it seems like some people who were previously reluctant to get vaccinated have changed their mind after seeing that there are, that it's very safe, that it's very effective. More data shows that it's effective against the variant. And all of these are helping people change their mind about getting vaccinated. And this is really encouraging. And we just want to continue to encourage everyone who is eligible to get vaccinated at the first opportunity. So as soon as you're offered a vaccine, please take the vaccine that is offered to you. They are all highly effective in reducing complications of COVID disease, reducing hospitalizations, and reducing deaths. So please get vaccinated. Someone asks about a viewer who reached out about strange symptoms that are being reported called parosmia. So this is where a sense of smell has been altered. So not necessarily losing your sense of smell, but maybe, some COVID patients reporting an altered sense of smell where they smell things that appear to smell, very bad, or they can smell it, but no one else can. So there are some, scientific reports on this, but just remember, COVID-19 disease is a very new disease. We're still learning about the acute symptoms associated with COVID disease, and we don't know if these kinds of things will last or if they'll recover and then you'll be fine. But yes, there are some clinical reports of people with COVID symptoms having an altered sense of smell. All right, one last question, and then I'll turn it over to Dr. Eichel. Someone on Facebook saying that they had COVID last summer and they have tested positive for antibodies since then. And we're asking, is it okay for them to get a Pfizer vaccine? So remember that the antibody tests for coronavirus that are currently on the market are not specific to SARS-CoV-2. So These antibody positive tests may be a result of your COVID infection. They may be a result of a common cold infection that you had last year or 3 years ago. We're just not sure. In any regard, get vaccinated. Do not let the fact that you have tested positive on an antibody test keep you from getting vaccinated. However, just be aware that some people who are COVID recovered, what we call that, had COVID disease, so had some natural immunity, some folks who then get vaccinated have mentioned, feeling like they, just didn't feel well, they were tired, or maybe, just didn't feel right the next day and just decided to stay home. And that can happen when you get vaccinated, and it boosts that natural immunity that you developed because of your COVID infection. So just be aware of that. You may have a little extra soreness at the injection site. You may not feel quite right. You may want to just stay in bed the next day, but certainly do not let previous infection or a positive antibody test keep you from getting a COVID vaccine. So we will talk again on Friday. Before I turn it over to Dr. Eichhold, we do plan to have, hope to have, first dose vaccine clinics this week. We thought we had it all worked out, and then Mother Nature seems to be interfering with our plans again. So as soon as we see what the storms might do, that are projected for our area the middle of this week, we will make some decisions and let you know through our social media outlets and on mchdcares.com if we're able to offer first dose vaccines this week. So I will stop there and turn it over to Dr. Eichhold.
Thank you very much, Randy. We're excited that we're expanding eligibility for those people who can become vaccinated. So on Monday at the cruise terminal, we're going to have a large clinic that'll start 8 o'clock in the morning and go till 8 o'clock in the evening. People have indicated they wanted an evening access point to be vaccinated, so that's going to occur Monday at the cruise terminal. We're sorry about the weather conditions this week, but in dealing with safety, we want everybody to be safe. And again, thank everyone for wearing their mask as we move forward. We still have a ways to go, but get vaccinated when you get an opportunity. And we hope see the younger generation or younger group coming out starting on Monday, and excited about the governor's announcement. Thank you.